Hello and welcome again. We're just trying to show you how to use the ABPM that we've provided for the practice with the Meditech 05. First things first, we will have loaded the software onto whatever PC you have in the practice that would usually have it. This is the MediVisions logo. It's a heart like this, CardioVisions, pardon. So we open CardioVisions. Everyone is going to have a username of user1 and the password will predictably be password. So I'll just enter that, user1, password. Click OK. Now we're in. Now the first thing we'll do is, this gets you in, you're into the program, you don't need to worry about anything else for the moment. We'll take it as if we're just adding a new patient. Our patient today is going to be called Mary M. Okay, so you click on Add New Patient, which you can see is to the left hand side of the 4 giant squares we have here. And we go into this Add New Patient wizard. So then we just click Next. I'm in as Hayes, you may be in as user1, that's fine. Next. So I want to put in, first name is Mary, last name M, she's female, 10, 8, 9, I was going to say 1854, 1954. And the ID is important because this is the P number. So every patient in this trial, we will have given you a list of the patients who we came across as having resistant hypertension, and they will have codes opposite their name that we want you to use for this program. So for this it will be P, let's say P5, which means practice 5, patient 8, which would be 008. Or whatever the code is for the particular person you have in front of you. Please match this up. Next. The wizard has been successfully completed. Finish it. So the first thing we have to do next is we want to add new patient is clearly up here. Next thing we want to do is we want to program the box because we want this patient to go away with the box. So programming wizard. Click on it. Then straight away next. Find the patient. It was Mary M. That's who we wanted. So next. Now, you don't need to do anything with the monitoring plans. The UK monitoring plan is fine. That's readings hourly, nightly, 30 minutes during the day. Except without modification is already ticked for you, so you don't need to do anything here except tick next. Check the time is right, 3:45, indeed it is. Then next, this just is a summary of what's been said previously for next. Now this is the important bit. Here is the box. We're going to attach this box to the computer or your PC. The most important thing is the red goes on the bottom. Click. Then this USB feeds into your computer, your laptop, whichever you use. Then you just click next and this will automatically sync, okay? So the CardioVisions on your computer will tell this box what to do, which is the standard way of operating, which is hourly at night, 30 minutes during the day. The wizard has completed its job, finished. We're done, so we're ready to go. So you remove this and out. The box is ready. In order to just test it before the patient goes out, what you need to do is connect the blood pressure cuff. So you can see there's a place for this to just easily slide into, but then you have to twist to tighten. So slide in and it clicks again. So I'm just going to briefly place this on a kind volunteer here. Generally the cuff will be placed upwards, okay? Or the tubing will be placed upwards rather, as this will be how the cuff will be arranged on any particular patient. So then the next thing is we need to press this arrow here just to give it a test. I let that run, but you'll hear it inflate and deflate. This is just mainly to test that the machine is capable of taking a blood pressure, okay? And it should be accurate or accurate enough to what you have found previously in that particular patient. When this is complete, we basically put the box on the patient and we let them out the door. It is as simple as that. Okay. We'll just wait for it to run. I won't give you the readings because that's not fair. It's personal healthcare information. But I'll just hold it and make sure that it gives a proper reading. and indeed it does. So what I'm going to do is now I'm going to place, if you can see, cuff around Monica, and the box will hang like so. So you can see upwards around the neck, the box will hang like so. And what we have finally is a belt. And the monitor goes into the belt, as Monica can show you kindly. And the belt has two forms. One goes around the waist, and some people are happy enough to just have it around the waist. But you should also notice that there is another strap that can go around the neck. Whether you use this or not is between you and the patient. But we certainly, you will need to use the belt strap. A patient is ready then to take this home. You can lengthen the one around the neck if you wish. And sometimes what some people do is place some tape here, as you know yourself, just on the jersey, just to make sure that the wiring is just kept secure so it doesn't fall and annoy the patient. The only other issue is it's probably best that people wear loose-fitting clothing so they can get them off. If somebody needs to remove it, obviously they can take the wiring around their head and remove their jersey. Okay, thank you very much. We'll show a further video later on to show you how we receive the data. Thank you.